It has created some distrust, and I definitely do understand that.
My parents grew up in the Deep South in Jackson, Mississippi. When my mother had a toothache, of course, they could not go in the front door. They had to go to the back door. They wouldn't actually feel your tooth. They would actually pull them. And so what it developed in her is this apprehension about going to the dentist that she lived with for many, many, many years, even after moving to Minnesota. And that kind of fear, I think, is pretty pervasive within the African American community. It's a fear that emanates from a historical reality.
This historical reality is that African Americans have been neglected and mistreated by medicine, health insurance, as well as banking and other financial systems.
African Americans didn't come to this country as buyers and sellers and participants in the market in a traditional way. We were the property in the market that was being bought and sold.
Medical experiments, malnourishment, poor hygiene, sexual assault, exposure to disease, violence, and many other maladies were visited upon the physical and mental health of enslaved Africans.
Yeah, the thing that many people don't know is that for us, on many plantations, health care was attended to by veterinarians, not by physicians. So there's been a long, deep distrust of health and the care of our people.
The medical and scientific community supported racist ideology with diagnoses specifically for blacks. Medical science even identified being black as a disorder, calling it negritude.
The slave owners had to justify their treatment of my ancestors by convincing themselves that we were an inferior people, therefore denying health care, denying education, denying family, so they could live with themselves.
Following slavery, from Reconstruction through Jim Crow segregation, separate but equal laws perpetuated the unequal access to health care. Some scholars conclude that much of today's health disparities are directly attributable to the slave.